The Hazardous Materials Management is a program that outlines the administrative structure, related programs, and guidelines in the selection, ordering, inventory, handling, storage, labeling, and controls that we should be aware of whenever we are exposed to hospital chemicals. Annual inventory is submitted to the FMES committee. The top units with the most number of hazardous materials are identified and inspected during physical walkthrough activities conducted by the Hazardous Material and Waste Management Committee. This is composed of staff from the unit, CSRM, and FMED representatives. Aside from that, there is internal quality audit or IQA. This is done by the Hospital Compliance, License, and Accreditation Division, where observations are based on the existing standards and all findings are coordinated with all concerned units to provide risk reduction strategies. There are also suggestions, observations, and findings of accreditation and regulatory bodies that checks the hospital compliances. All findings are monitored and necessary actions are taken to address findings and minimize the risks. The last assessment is from the activity of the multidisciplinary environmental rounds, where common and critical areas are inspected to ensure safety. When there is chemical spill, it is reported within 48 hours through the Automated Complaints and Incidents Tracking System, or ACITS. For those who don't have access to the system, generic incident report forms are used and submitted to the Clinical Safety and Risk Management. Centralized storage is marked with limited access, first in, first out, and/or first expiry, first out rules are strictly followed in this area. MMC has primary and secondary label for containers. Primary container is from the importer, manufacturer, supplier, and distributor, and they provide appropriate label to products. It provides an additional information for an open container. Spills are classified per category and size. In handling minor spill, 3 C's is applied: caution, call, and contain. Emergency pop-up caution cones are available in strategic locations of the hospital. They can be used during incidents of spills. For major spills, Dr. Orange is activated and implemented by the emergency preparedness team. Hazardous waste management outlines the proper guidelines in the collection, handling, storage, transport, treatment, and disposal of hazardous waste. Hazardous materials and wastes inventory is updated annually. There is also a quarterly self-monitoring report system and semi-annual compliance monitoring report. Hazardous waste are properly segregated through color-coded bins inside MMC premises. MMC complies with all the requirements for hazardous waste generators as stated in DENR DAO 36 series of 2004. This includes proper segregation, collection, handling, storing, transport, treatment, and disposal. The fourth FMES program is the fire safety. This aims to protect MMC property and occupants from fire and smoke. Fire safety program aims to provide a safe and secure environment for the protection of patients, families, staff, and visitors or persons from fire, smoke, and other combustible products. The compliance assessment to the fire protection protocols is done through the monthly fire protection system inspection rounds, annual fire safety inspection of the Bureau of Fire Protection, scheduled internal quality survey of hospital compliance, license, and accreditation division, quarterly multidisciplinary environmental rounds, and pre-construction risk assessment. Fire prevention starts with identifying fire hazards by checking the areas for visible electrical problems on equipment, outlets, wires, etc. Avoiding octopus connections, identifying flammable liquids and storage of combustible materials, and turning off or unplugging of electrical devices when not in use. For good housekeeping, do not accumulate combustible materials, maintain proper and safe storage areas, do not store combustible materials in mechanical rooms or electrical equipment rooms. In example, alcohol, boxes, etc. Do not block access to electrical panels. Maintain a 36 inches clearance in front of the panel, and do not obstruct exits and fire doors, fire alarm stations, and fire extinguishers. To ensure preventive maintenance of fire safety equipment or system, in-house building maintenance service providers conduct routine inspections, testing, preventive maintenance of fire protection and safety equipment, and correcting deficiencies noted according to schedule. Examples given are fire extinguishers, emergency lights, fire hose cabinets, etc. No smoking policy applies to all hospital locations and patient care areas. The first offense in violating this is termination. What will you do in case of fire? Raise. Activate the alarm by calling Local 1000 and pushing the button of the fire alarm box. Contain the fire by closing the doors or windows. How to use the fire extinguisher. Remember the acronym PASS. P for pull the pin, A for aim the nozzle at the base of the fire, S for squeeze the lever or handle, and then S for sweep side to side. We have 7 fireman's cabinets installed in different locations. We have 4 cabinets in Tower 1, 1 cabinet in Tower 2, and 2 cabinets in Tower 3. All of those cabinets contain the following PPE: a self-contained breathing apparatus, fireman's suit, fireman's safety helmet, fireman's gloves, fireman's boots, hooligan axe, Unity fireman's axe, and it contained others as well: bolt cutter, sledgehammer. Permits. We have hot work permit form. This is used to document hot works. This is secured from FMED prior to every activity. We have the fire impairment request. Contractors shall secure fire protection impairment permit form from FMED for all utilities, fire protection detection, suppression and control. Must be carefully monitored and notified to ensure alternative measures are in place when emergency occurs. We will be having our next topic, which is the medical equipment safety.